The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. We are gathered here again on a Tuesday morning, whatever day it is for you, time of the day or night. But for me, it's Tuesday morning to record the next episode of TMD Demystified. I am Tony Urbanic. Today, we're going to finish up the series that I have been doing for the past 5 or 6 weeks. Entitled Value-Based TMD TMJ Treatment. Value-Based TMD Treatment. We're going to finish it up. The subtitle for today's episode program is Understandable, Adequate, Available Communication. If you are going to deliver value-based TMD TMJ treatment, that is value-based for who? Value-based for the patient, value-based for the doctor. But if it's going to be value-based, there's certain criteria, and those criteria have been promulgated, given full credit, by Dr. Robert Pearl, MD, who I've quoted on prior episodes as the author of his first text book. It's not a textbook, but book. Very well-written book entitled Mistreated: Why We Think We're Getting Good Health Care and Why We're Usually Wrong. Again, I'd recommend for those who are interested in their own health care and the health care of other people to read this book. I would say it's not perfect. I don't claim it's perfect, but I definitely experienced most, if not all, of the concepts that he brings out in his books and pretty much totally agree with what he brings to the forefront of our medical care in our country. What we would like to do, though, and what he promotes is value-based value-based healthcare. And I worked it forward, the concept, to value-based TMD, TMJ healthcare, or TMJ, TMD treatment. And the last part of that, the last concept involved, is to have proper communication with the patients on your medical topic. If you don't have proper communication as a provider for a medical, dental, healthcare service, you are not providing the complete package. If you're avoiding or don't know how to proceed with appropriate communication about what you're doing, you're not doing your job. You're not completing your job. You're not completing the whole package, which should be done. And it is your responsibility to do that, whether you like it or not. Now, we were not taught in dental school. I was not taught in medical school. I was not taught in my internship residency in oral and maxillofacial surgery how to communicate with patients. I did know how to communicate with my professor at Vanderbilt. It was quite easy. Whatever he said, my answer was yes, sir. And that is true. And that's pretty much unless I had a question to ask when I was confronted by whatever remark Dr. David Hall wanted to make to me as either an intern or a resident, my only answer was yes, sir. And that's how it worked back then. It does not work that way now, unfortunately. And I won't go into that. That's a different program. The disrespect that is given to people now is legend, and even our professors in school, which I have commented on before. But the point being is that one way or another, for the better or worse, I learned to communicate with patients. I learned to communicate with my fellow doctors. I learned to communicate with competition. And it's very important. But as a service provider, as a doctor of one kind or another, if you are not giving the proper communication to your patients about the service, then you're not doing your job. So now how does this apply to TMD, TMJ? Well, it's very specific. I mean, you know, in the old days, I gave up doing TMJ surgery about 13 years ago. But regarding that era of my career, I will fully admit, and not proud of it necessarily, when a patient came in to see me, I'll tell you how it went. You know, I would do the workup. A surgical workup was a little more extensive than our non-surgical workups, but a workup's a workup, and I'd listen to the history. I'd note the history, the complaints, the symptoms of the patient in the chart, and I would get appropriate x-rays, usually an MRI of the temporomandibular joint. I'd look at a Panorex. I'd do minimal examination of the joint. From a surgical standpoint, there's not much to learn about, you know, pushing on the joint or listening to a joint crackles or whatever. But I'd take that workup information, I'd listen to the patient, and then I would determine what surgical procedure that I thought was appropriate under the circumstances, whether it be unilateral, bilateral, whether it be open joint, closed joint, arthroscopic, whatever my feelings were in the current treasures that were delivered to me by my compatriots is the right way to do TMJ surgery. And I would tell the patient, well, this is what we're going to do. Rarely did the patient have many questions about the concepts of surgery or the specifics of surgery. Certainly, I always did cover potential complications of surgery completely. I did do that. What complications can we have? We can have bleeding. We can have recurrence of symptoms. We can have infection. We can have inordinate degrees of pain. And on rare occasions, you can even have ankylosis, and then you have to go through just the concepts of anesthesia, although I left it to the anesthesiologist because all these surgical procedures were done in a hospital operating room environment, and anesthesia had their own informed consents. But, you know, basically it was in my surgical career telling the patient what I was going to do without having to explain much about, well, are we going to take the disc out, and what's the history of discectomy, and you know, how well does it work, and what's the theory behind discectomy? All that wasn't covered at all. But on the non-surgical, after 13 years of doing this, 4,000 cases, I have learned and promote that, you know, using a non-surgical device, we'll try to keep it generic here. Instead of calling it the Urbanic device and protocol, we'll just call it a device. That if you're going to use a device, it is important that you impart to the patient exactly how it works. For sure. If you don't do that, then first of all, the patient isn't going to be as good a patient because you're going to ask them to do a protocol. It's about how they have to use it. Whatever that protocol might be, I have a very specific protocol that I promote. But you need to tell the patient how this little thing works, because I can tell you with lots of experience that patients will come back, and I've heard this so many times. I mean, it's not with every patient. I'm not trying to exaggerate here at all. But they will take this thing out of their mouth after 3 weeks to 2 months, and they'll hold it in the air, and they'll say something, I never thought a little piece of plastic like this could make all my symptoms go away. Now, and that has been a common comment that I hear. The issue with that, the unintended, unsaid concept that goes along with that is they did not fully understand, whether it be because of my lack of imparting that understanding, or I tried to get it to them, but they didn't fully understand. They didn't understand how this thing works, because if they understood how it worked, then they wouldn't be so surprised and hold it up and say, I never believed that this thing could do what you said it was going to do, because they didn't understand how it works. And that is the importance of communication when it comes to dealing with patients. And again, these are learned concepts. I didn't learn how to communicate with my fellow doctors. I didn't learn how to communicate with patients in the hospital and patients in the office clinic environment overnight. Certainly didn't teach it to you in school. And some people learn it well, some people don't learn it at all, as we well know. But what I'm trying to say here, for value-based treatment for TMD, it is critical, not just maybe, it's critical that you learn how to communicate primarily about how this thing works, because patients, well, number one, if they know how it works and it makes sense to them, they will accept the treatment. There's no doubt about it. I have seen many patients after a consultation, and I take them through the simplicity of how this thing works. And I believe I've done a pretty good job of explaining to them. And one way or another, they impart into me the concept that this sounds too simple. You know, it's too simple. And if they're going to accept treatment, they have to trust the doctor, they have to trust the treatment. And if it sounds too simple, if it doesn't make sense to them, or the opposite, if it's overly complicated and they don't understand it, they're not going to accept treatment, or less likely to accept treatment. If you have good level of communication, the level of trust goes up. And that's the primary point of my presentation here today. And think about this just a little bit. Think about how you've experienced this yourself, whether this is real to you. When it's real to you, it's real to you. If you've experienced it yourself in communication with patients. But if you are really good at communicating a topic, whatever that might be, then naturally the trust between the patient and doctor goes up, because the doctor communicates well what he is doing, or what he is attempting to do, or what he proposes to do. So secondly, communicate with facts, not smoke and mirrors. So it's imperative that when you do communicate about how this works, that you use facts and not theory to present the situation. Now, one of the things that I've learned to do over time is to, you don't have to get complicated. You don't have to take a lot of time to communicate. It's a matter of challenging yourself to get the facts in before the patient and to make it as simple as possible. So along those lines, what I usually say regarding how this thing works, and I first talk about what it doesn't do. It doesn't keep you from clenching or grinding. That isn't what it does. We don't even understand the mechanism for clenching and grinding, other than it's related to stress. So I make that clear. It fits in the mouth, but doesn't do anything in the mouth. But what this does, here's the simplicity of it, because it separates the back teeth, taking the loads off the joint, does the same thing as a set of crutches taking the load off a bad knee. I use that because patients are very familiar with crutches. They're very familiar with inflammation and pain in the knee. And they know that if they go on crutches and they have a bad knee, it's going to make the pain go away. That's why you use crutches. Well, this device basically does no more and no less than unload the temporomandibular joint to the point where the inflammation decreases. And you compare it to a set of crutches on the knee, and all of a sudden, in patient terms, it makes sense. And that is good communication. So you don't have to go into the weeds. You certainly don't want to be using a lot of big, complicated medical Latin terms. Don't speak in Latin. You want to speak in Latin, speak to your colleagues and see whether they paid attention in course. in their courses in school. But with patients, don't bother trying. You don't have to be important. They will think that you're important if you can actually communicate in their own terms where they can understand something. Then they will think you're important, not because you have no Latin terms. And this is very simple. So, make your communication simple. Now, how do you make this translation into something that the patient understands? Well, first of all, you make your delivery any way you'd like, and you kind of practice your delivery about talking about how it works, what are the facts about it. But basically, it's based on what the questions over time the patients have. So as you see more and more TMD patients, they're going to have some questions for you. And early on, maybe some of the questions you may not have an immediate answer for, at which point, in this case, you can call us up, call me up, email me. But you develop your communication basically on your knowledge of what patients really want to know, and they do want to know how it's going to work because, well, another reason, they're going to come into your office with a handful of night guards. I see it all the time. And they've been to 2 dentists, 4 dentists, 6 dentists, and they'll have literally a brown paper bag full of night guards, and they want to know, and they sheepishly say it, but one way or another, they say, how does this thing differ from this bag that I have here? And you have to be able to answer that question honestly with facts. And that was, I think, one of my last episodes, is kind of commenting on my feelings, my knowledge about night guards. But you don't have to, it's not about bad-mouthing anything that doesn't work. It's about explaining how your treatment, how your device and protocol, exactly how it works. And that takes just a little bit of practice. And based on what you perceive are going to be the questions or actual questions for the patient, and you can literally go through a very brief presentation that may take no more than a few minutes. I mean, literally, I've got my consultation worked down to less than 15 minutes, unless the patient has an inordinate number of questions, which I'm happy to answer. But basically, you collect your symptoms, do the 2-minute, 3-minute examination of the oral cavity and the temporomandibular joint, looking for evidence of bruxism, looking for evidence of occlusal problems, looking for evidence of inflammation within the joint itself. If it hurts, it's inflamed. Confirm your diagnosis, and then explain what you recommend and explain how it works, especially how it works, what you can expect during and after treatment. There's an episode earlier, I don't know the number, but you can look it up, on a example consultation that I literally videotaped and that I have in one of the episodes. You can actually see what I do myself, but I prefer that you, if you do this, learn, your own mechanism when it's real to you, and you make it your own. But those are the parts of it. You ask the questions, you get the symptoms, you do your exam. If you have a positive exam and you have positive symptoms, then you make your diagnosis. Based on the diagnosis, you recommend your treatment, and then for sure explain how it works in terms that the patient can understand, is understandable. So value-based TMD treatment, number one, your communication must be understandable. Keep the Latin to a minimum. It must be adequate, mostly, adequate being that you cover how it works. If you're not covering how it works, it's not adequate. And that you make your communication available. And again, it doesn't mean that you have to sit and listen for a half an hour to a patient who wants to drone on to the 10 different doctors that they have seen. And I have experienced that. I have more than once. Many times, the patient sits down and they want to tell you about the years of experience that they've had visiting doctors and being recommended this and that, and the different devices and how it felt afterwards. And that's not necessary. That's not part of a consultation. You don't have to accept that. It's okay to cut the patient short and literally say, you know, Mrs. Jones, it really is irrelevant what you've done in the past. I just really want to know what your current symptoms are. If I feel it's important for me to know what some other doctor done for you, I will go and I will be asking you. But right now, I just want to know what your current symptoms are. What are we trying to solve here? And then I'm going to ask some additional questions, and then I'm going to do an exam, and we'll see where this goes. That's how I deal with it. So you don't have to listen to a patient drone on, which many of them want to do. So an average consultation, which primarily is communication between patient and doctor. The patient needs to give their communication, which is listing out their symptoms, telling you what it is in their own words, what the symptoms are, so that you can translate their words into factual symptoms. One or more of the above: frequent or recurring headache, earache, jaw pain, neck pain, tinnitus, subjective hearing loss, vertigo, dizziness, upper back and shoulder pain, arm, hand, finger tingling and numbness, and various kinds of locking. And they will give you all kinds of descriptions, but all of them will fit into one or more of those specific symptoms. So their part is giving you communication, and your part, once you confirm your diagnosis, then your part in the communication cycle is to be complete and to be available to them, to give them complete understanding of what it is that you recommend to do for them, how it works, and what can be expected after. In other words, for example, painful symptoms come down pretty fast. Within the first week or so, you will see significant painful symptoms decrease. Subjective hearing loss, vertigo, and tinnitus, they take longer because they work through a different mechanism, the Petro-tympanic fissure. Don't say Petro-tympanic fissure to a patient. They go blank. They will go blank if you say that word. And then you're behind the power curve, as we say in aviation. Then you have to correct yourself. Stay away from big words. So take adequate time, but it doesn't take long. You can, after you really groove in talking to TMD patients, you can get the whole consultation done in 15 or 20 minutes, very nicely, very adequately. And the patients respect that. And the patients really understand, and more likely than not, by far, they will accept treatment when they understand it personally. And when they do that, then you have value-based TMD care, TMD treatment. And that's the whole concept. So we've completed this series. The other episodes I'd recommend that you review. If you would like to become an expert, not only just a technical expert is the device and protocol, but a technical expert on delivering the service so that you can help as many people as possible. So the 6 segments that we covered were the value-based treatment would include high degree of documented successful clinical results. It would include a simple, transparent treatment. It would include excellent patient compliance. It would include minimal side effects and unintended consequences. It would include sincere and effective and compassionate delivery of the service itself. And then finally, what we talked about today, having communication between the doctor and provider that is totally available, is understandable and adequate. I hope you get the point. Our mission, my mission personally, and the mission of our company, TMJ Services, is to make a service available to patients that truly is effective in treating TMD disease. If you'd like more information about what I do, what the company does, that's on our website, www.urbanictmj.com. I can be reached personally at tony@tmjservices.net. Our Director of Medical Education, Dr. Naomi Williams, and she is also our COO, can be reached at naomi@tmjservices.net. We are having a significant increase in interest in what we do, and I think that is because my sincerity and trying to get the solution out there as far and wide as possible to the millions, primarily women, who suffer daily, because I hear the stories all the time. I hear the stories all the time of the long-term 10, 20, even 30 and more years of patients being run in circles about this problem that everybody calls TMJ. For today, we'll wrap it up. Next Tuesday, I will select another topic. We will get off this topic of value-based treatment and go on to the next, hopefully interesting topic for you. For today, I look forward to the next time we speak. I am Tony Urbanic, and this is TMD Demystified.